My name is Marina Magrey. I'm a professor of medicine at Case Western Reserve University at University Hospitals, and I'm here today at ACR Convergence meeting 2025 and reporting for our room now. This abstract I found this abstract very interesting. NSAIDs, they've remained a cornerstone of treatment for joint pains and even for axial spondyloarthritis. And however, we are concerned that they may cause flares of inflammatory bowel disease and avoid in patients with underlying inflammatory bowel disease. This study, it was a retrospective study that looked at an Optum database over a period of 2 decades, patients with inflammatory bowel disease, and there were about 8,000 patients that were reviewed, and about 35-36% of these patients actually were on NSAIDs. And what the main outcome was hospitalization by flaring of the underlying inflammatory bowel disease in patients that consumed NSAIDs. And what the study found was that the overall risk of hospitalization was low. For the group, the hazard ratio was about 1, and in fact in ulcerative colitis patient there was no increased risk, but there was a moderately increased risk in patients with Crohn's disease. So the conclusion from the study was that these patients with underlying inflammatory bowel disease, the risk remains low except in patients with Crohn's disease. So we may be able to judiciously use NSAIDs in some of these patients, and I think this data will help to formulate new guidelines about the use of NSAIDs in inflammatory bowel disease.